Yeah, and another important thing that you told regarding the usage of lab investigations in Ayurveda practice. Of course, there is very senior set of hardcore Ayurveda practitioners who do not want to use lab investigations at all. And the client has brought it, looking into the lab investigations and analyzing that will go a long way to help the practitioner in understanding the samprapti better.
No, it's always better whenever we finalize any condition with the patient has approached to us on the lines of Ayurveda, it has to be backed up by something lab investigations or imaging techniques as a modalities to prove the science is totally scientific, because we always find a certain bad tagging has been done to Ayurveda, that is a pseudoscience, doesn't holds the scientific validity. So that has to be removed. We need to utilize those lab investigations and imaging techniques and keep it as an supportive document before treatment. Whatever it is there, it should be taken care, and then you do the treatment with Ayurveda. Then once again take the repeat scan or repeat imaging techniques or use a repeat laboratory techniques and investigations, then find out the difference what has occurred due to the influence of our treatment. So then try to compare it. So one thing is whether by analyzing those lab investigations, how can we assess it is a vata, pitta, kapha? That is altogether a different type of debate, a different type of issues. The thing is here, we need to use those tools to prove this is a scientific methodology, and we are using those scientific methodology to prove that Ayurveda is having a potential and it can be treated as any other medical science in the world. Because many a times we find there is a bad tag being attached to Ayurveda, saying that it's a pseudoscience or something like that. So that has to be taken care of. When a larger community or a scientific community feels that something which is, if we speak in those languages or their language, they can better understand what we are telling.
Even for the patients to get convinced, if they have like before treatment and after treatment, it becomes very convincing for the client also. Suppose blood sugar is high, and suppose it was like fasting was around 200. Then after a month of treatment, say it came fasting up to so 150. It came there. So if there is a progress, then patient will also gain confidence on the doctor that there is some progress being made. So sometimes if the patients self-analyze their own symptoms, they'll not be in a position to judge whether the improvements are going on or not by themselves. So if there is a hard document, scientifically proven lab report, it will be very easy for the doctor to convince them, and it will also easy for the patient to trust the doctor more.
Definitely. That not only that, even if you want to later present the cases of Ayurveda, what you could on the lines of Ayurveda with the using of Ayurvedic medicines and supported and documented and by the lab investigations, then definitely it will be a very good one. And you can go for publishing the data in a peer-reviewed journals or something like that. So it gives a confidence, and even people will get convinced about the way we practice, and even the results are also convincing to the patients. Many times it so happens a liver function test. Many times a patient comes with hepatitis. Of course, very easily we can observe that there is a yellowish discoloration in the sclera or eye that can be taken care of. But once a treatment is given, that goes off. That is also there. But still, if it is analyzed it through, supported by the lab investigation by LFT values, where serum bilirubin and all these things are there. Then before treatment was the serum bilirubin was 9 mg per deciliter. Now it has reduced to 1.2. Means that's a very great achievement, and that can be done through Ayurveda medicine also. That could be established. That has to be needed because not only correcting the doshic balance inside, it is also to be understand that there should be some tool or a model to analyze whether it is happening really or not. So that we have some option now available in the form of lab investigations and imaging techniques. So why not we don't use it?
Yeah, even in countries like US, most of the lab investigations are under the purview of the MBBS doctors. Now there are some breakthroughs made by these startups, technology companies who are into biomedical sciences. So they are coming up with different tests which the client can undergo himself rather than waiting for the prescription from a doctor.